we missed it because of the avatar meeting, and I knew all of us, or most of us, would be busy in avatar, and including the overseas guests, who come in large numbers to avatar. And it was a great meeting. It was a combined meeting, you all know. And Dr. Bhalla, one of the key organizers, is sitting here as guest of honor today. And so let me, just briefly introduce the topics to be discussed today, and we'll, go on to the meeting after a customary introduction of the guests, although most of them are very familiar to us. So for long, we have been wanting this ever since Tushar came out with this paper on, puncturing AV fistula by creating buttonholes. And actually, Sampath only, showed me this article and said one day we should call Tushar. But somehow it was taking long and we couldn't get organized that. And today he has come up. We know that buttonhole thing was a very novel thing to start with, and it looked very attractive, easy for the technician and the patient. And but somehow we were getting bad comments on that, so their controversy continues. So I think Tushar would be clearing up, telling us the pros and cons of that procedure. So we'll be hearing from him. And the other topic is on temporary dialysis catheter. Actually, I was asked to talk on this temporary dialysis catheter for Avatar. For a while I was quite, cheesed off, like, why talk about temporary catheters when you can talk on so many interesting high-tech things. Then as I was preparing, and as I got to know, how frequently people use temporary dialysis catheter in our practice, I realized that it is a very important thing, and no way we can escape using temporary dialysis catheter. So we should be learning to live with it and see how best we can use it without getting into troubles. So, and I also knew that Vel Aravind had a brilliant idea where he was trying to use a temporary catheter in a modified method, so that the infection rates could be less and it could be used for a longer time with very low cost. So I wanted to introduce it. Actually, he had presented it in one of the earlier meetings, but I wanted the informed audience, especially the juniors and those practicing in smaller centers, whom would be greatly benefited, as most of the patients may not be able to afford tunnel catheter, because of cost. So these being the topics, and today our chairpersons would be Dr. Bhalla and Dr. Chandrasekhar. And for long, I had wanted Dr. Bhalla to join us as a guest of honor. We know that, he's a very senior nephrologist in the national scene. And he is, he got into interventions very early, along with Dr. Anna sir. And he has been doing AV fistulas for ages. And I thought introducing him to the audience of Inform would be very right. And he should be, I would request him to, speak a few words about how he got interested in that procedure and how, the difficulties he had faced in the early days. And his achievements and the qualifications are too well known to us. He has been awarded Padma Shri by President of India in 2010 itself, and he has got the, very likable BC Roy National Award in 2019. And besides that, he has multiple awards and honors. And he is a member, not only member, he has been leading many academic bodies. He has been president, he is a sitting president of Indian Society of Nephrology, and he was past president and founder member of PDSI. And he has had senior positions in numerous national and international societies, and I won't be listing all of them now. And the other guest today is Dr. Chandrasekhar. Chandrasekhar is from Chennai, and I know him for a very long time. And he, one of the early people to take up tunnel catheters in a big way in those days. So I thought it'll be very apt to dragging him into this forum. He had his MBBS from Tanjavur Medical College and MD from Madras Medical College and DNB. Then later he had training in Royal College of Physicians and European Renal Association. He got a C in nephrology, and he has been working in very reputed institutes where and he was closely associated with a lot of high-tech things, especially liver transplant and pediatric transplants. So he started his career in Bilrath Hospital. Then he was assistant professor in Ramchandra Medical College, and later he became associate professor there for a while. And then he settled for a long time in Global Hospital, Global Health City in Chennai, where he spent nearly 10 years. Which is a very famous center for liver transplant and things like that. And now presently, he is the director and senior consultant in the Institute of Renal Sciences and Kidney Transplant, MGM Healthcare Private Limited in Chennai. And Chandru, we are happy to have you here. And we would like to hear comments at the end of the talks. And let me call Dr. Bhalla to, just to give his introductory remarks to this passionate crowd of interventional nephrologists in this forum.
Thank you, Dr. Bhalla, for the kind introduction, and thanks for inviting me to this very, very important, informative forum. As you said, that how I got interested in vascular access, actually that was actually need based, because as we know, the necessity is the mother of invention. Because when we were all the time looking for surgeons, and for surgeons this was a least important job, and that too that they will hand it over to some junior most person or maybe some resident. So at AIMS, Dr. Rana was facing the problems when during his training, and at the time I was in PGH Chandigarh, and I also used to face, because the transplant surgeon were not giving any time to our patients, and for months together, for 6 months, 7 months, continuing, we were dialyzing them just with femorals, alternating right and left, and that's how the dialysis was being given, and hardly any patient was getting good vascular access. The question of maintenance dialysis was not there. So then when I joined Ganga Ram Hospital, then I found that this area we were grossly lacking, and we didn't have good vascular access. And here we started getting patients for maintenance dialysis. And we were getting referral from all over North India, because there were not any much private centers, hemodialysis center doing maintenance dialysis. So whole of UP, Punjab, Haryana, so we were getting the patients. And somehow they knew that our center was making vascular access ourselves, because at the time the vascular surgeons were not there, and no surgeon was interested in doing vascular access. That's how we started making AV fissuras. But one thing I want to share is that we used to make a lot of AV shunts in acute patients. And please believe me that we hardly had any infection with AV shunts. Wonderful vascular access, no recirculation, and after 3 or 4 weeks in chronic CTD patients, we used to convert this AV shunt into AV fissura, and this fissura could be used within 2 weeks only, because it was already mature vein, and just proximal to the shunt we used to make AV fissura, same artery and vein. And it was so good vascular access. But now, because somehow the shunt material is not available, I will still request Dr. Tushar if he can somehow give us the shunt vessel tips and shunt material. We will still like to go back to AV shunt and AV fissuras. Then once we had a failure of radial fissuras, then we started making brachial fissuras also. And I used to make brachial fissura myself. So I must have made about thousands of fissuras. So even transposition of basilic vein, even in the forearm, with transposition of the ulnar vein to and making a tunnel across and joining with the radial vein. So even the ulnar vein also I have used in many forearm fissuras. So we have done a lot of innovations. In fact, I presented this work in Japanese Dialysis Society therapy at that time, about 25 years, 30 years back. So that's how it is so rewarding actually. Other than the source of revenue, it is satisfaction for us as well as from patient point of view. As we all know, the good vascular access is very important. So at that time, initially, we didn't have any tunneled catheters, and we were so happy with these AV shunts and AV fistula combination. So I given a chance, I will still like to go back to AV shunt if it is available. So now we are making, after that, we are having 6 DNB students every year at our center. So at a time we have 18 students, and all students, all consultants now automatically they are trained in West courses. And we know that it is very important to have our own OT. So now we have minor OT available right in our dialysis unit only. So where the anesthetist also is available. So we make AV fissuras daily. So I think every nephrology unit should be trained as far as vascular access is concerned. Thank you.
Bala sir, you're not audible.
Yes. Chandru, you want to, can you give your entry into interventions?
Okay, sir. Yeah, I entered into the intervention, the tunnel catheter, way back in 2004, 2005. You know, Dr. Raja Magesh, when he translocated from UK to India, he has brought in some 30 to 40 tunnel catheters, cup catheters at that time. At the time, there was, you know, that there was only flat sheath. Sheath will be oval shaped, right? And stepped catheter will be there. That's only 28 French and 32 French, only 2 are available. We used to do by the bedside only at that time. So we started way back in 2004 and 5. I think on one side, the patient will be having dialysis. The next bed, we were used to do a pump cath, but we ended up with few complications at that time. We had once a hemothorax by doing the bedside, then we shifted to the theater. And more we end up with, we have seen the guide wire passing through different vessels, and we have evolved like this. But doing a vascular exact intervention, I'm not much into it because I don't feel the necessity being in Chennai. But you and Vel Aravind is a source of inspiration for me to still implement. But I do go to the transplant program. I even now I just prepare the beds for the recipient. I do some venous anastomosis, renal vein anastomosis, and even until the ureter. This is how my international nephrology is still hanging on, but I have not done the exact vascular procedure like fistulas. Yes, I have done around 10 with under supervision, but I used to do renal vein and one side of renal artery still. That's how, and you and Vel is a source of inspiration for you, both of us. Both of you are inspiration for me.
Thank you. Thank you, Chandru. I think we'll go on to the meeting per se. And Dr. Tushar, we've been waiting for his talk for a very long number of months. And no need, it will be very superfluous to introduce Dr. Tushar to this audience. And it's not only that he is an expert, internationally recognized expert in the field of interventional nephrology. He is close to all of us, and his keenness to transfer his not only knowledge but his helping hands to India, especially all our aspiring interventional nephrologists, and guiding us how to go about expanding this field and all that. I think we all owe him a lot. And welcome, Dr. Tushar. And please share your slides. And I think at the end of your talk, you can add something. I remember you asking about, is there a scope for re-entry of AV shunts. Sometime back, you were asking about some data or anything such that happening. So, I mean, Dr. Bhalla brought that, how we migrated from shunt to AV fistula. Is there any chance, maybe far-fetched, going back to, in some cases at least? I think you may give your comments at the end of your talk. You please share your slide. I'll stop here.